Hi there. This is Dr. Hugo Gonzales, clinical psychologist, and this is your program, your YouTube channel, Insight. Once again, thank you for accompanying us in this channel. Today, we are going to cover the intersection between trauma, addiction, and psychoanalysis. And we understand that trauma and addictions are complex psychological and behavioral issues. And they can be explored through the lens of psychoanalysis, which is a theoretical framework developed by Sigmund Freud and further expanded by other psychoanalysts. Psychoanalysis seeks to understand the unconscious mind and the influence of the unconscious mind in our behavior and the ways in which early experiences shape an individual's psyche. When it comes to trauma and addiction, psychoanalysis can offer very clear insights into the interplay upon the potential treatment approaches. So how can we understand trauma from the psychoanalysis perspective? In psychoanalysis, trauma is often seen as a psychic wound resulting from an overwhelming or distressing experience. Typically, these experiences are going to happen in early childhood. These experiences can create emotional and psychological scars that persist into adulthood. Traumatic events can lead to the development of defensive mechanisms, such as repression or denial or dissociation, which are unconscious ways of coping with the emotional pain associated with the trauma. So psychoanalysis aims to uncover these repressed memories and bring them into consciousness through techniques such as free association, dream analysis, and transference, enabling the individual to process and integrate the traumatic experiences. Also, in this context, we want to understand the addiction in the context of psychoanalysis. So addiction is going to be viewed as a complex response to emotional distress and inner conflict. Psychoanalysis suggests that substance abuse and other addictive behaviors may serve as a way to self-medicate and alleviate emotional pain. So addictive behaviors, therefore, can be seen as a form of defense mechanisms to avoid confronting unconscious conflicts and painful emotions. So the addictive substance or behavior temporarily numbs the individual's psychological pain. So psychoanalysis then aims to explore the underlying psychological dynamics that drive addiction, such as unconscious conflicts, unresolved childhood traumas, and repressed emotions. So let's look at then the interplay between trauma and addiction. So trauma, therefore, can be a significant contributing factor to the development of addiction. Individuals who experience a trauma may turn to substance or addictive behavior such as a means of coping with the emotional fallout of the traumatic experiences. In psychoanalysis, it is essential to uncover the specific traumas and unconscious conflicts that underlie addictions. These involve exploring the individual's life history and understanding how traumatic events may have shaped their addictive tendencies. So psychoanalysis as a way of treatment and trauma addiction is an option in terms of an intensive is offered as an intensive way of treating trauma and addiction. And the goal is to delve into the unconscious processes that drive these issues and facilitate emotional healing and personal growth. Techniques, as mentioned before, like dream analysis, transference, and interpretation of defense mechanisms, are employed to help individuals gain insight into the root causes of their trauma and addiction. By bringing repressed memories and emotions to consciousness, individuals can work through their trauma and develop healthier coping mechanisms, reducing their reliances on addictive substances or behaviors. Once again, thank you for being part of this program, Insight. See you soon.